think we introduced some of the basic problems that we have with Obamacare, and we talked about some of the Republican alternatives, which are still not getting much press, but the idea of bringing tort reform, competition, both into any health care debate we have. Also, we talked about the fact that we're dealing with what's called a crisis when the polls are showing 86% of the people happy with their health insurance. I don't think it's a perfect system, and I'm not saying it doesn't need to be worked on, but I don't think this massive plan that the House has produced, that we had sitting on the table in there that was at least 10 inches deep, is the answer.
What were some of the concerns that you heard from the crowd today as they voiced those?
Well, there was a lot of anger. Thankfully, it wasn't directed at us. I think in general, if I could summarize the tone, it was just we don't need any more government running our lives. We don't need government control of health care. We want to keep good quality care in the United States, and we need to do that by keeping the government's role small.
Well, I think one of the things that people were surprised is that the Republicans do have a plan, and House Bill 3400 outlines that, and it hasn't really gotten the coverage. And that was one of the things that I talked about there, was the lack of coverage on events like this. And I have to issue a mea culpa to the Tolbert report, because I said we only had one media outlet there, and it was Channel 11. We thank them very much, but you were there, Jason, and I really appreciate you too. So the proposals that are out there include things like the ability to buy private health insurance for every person, be able to buy their own health insurance, that it be portable, that it be transportable across, and be able to compete across state lines. No pre-existing conditions would be allowed. So there are some great proposals out there in Congress. I think the current situation, this bill is stalled, and it may be dead as long as the people that we saw here today continue to express their concerns for what is actually in the bill versus what is being spun out of Washington. I don't think they're going to be able to advance this bill, the Democrat bill, in the House floor. So it'll be very interesting to see what the result is after everyone goes home from the August recess. And I really encourage people to stay involved, because I think the situation is such that they're going to probably have more input going forward than they've had so far. So it was great to see a good turnout here today.
I think the most important thing to realize is that we need to make some minor changes to make sure that the truly needy receive health care. But I'm very concerned that we're going to rip up our entire health care system. It's very satisfactory to a large majority of the people, just to satisfy what's really a relatively small problem. You know, depending on the polling data, 75 to 85% of the people in Arkansas, or about 86% of the people in Arkansas, are either satisfied or very satisfied, or somewhat satisfied with their health care. And so it's really important not to rip up the whole system in order to satisfy a small group of people who don't receive the health care they're entitled to. So we need to make minor changes. And it's kind of like, if you had a sprained ankle, or you had a broken toe, you wouldn't want to amputate both legs. It's kind of like that when you have 86% of the people reasonably satisfied with their health care system.
What are some of the changes you would like to see, some of the improvements you'd like to see to the health care system?
Well, one of the most important things to do is try to inject a little competition into the system. If we had a little more competition and more choice, we'd have lower prices. And it's really important to let people try to buy insurance across state lines rather than having just a very few limited number of choices. Another thing we need to do is try to deregulate the system a little bit. About 10% of our healthcare costs come from defensive medicine. You got a lawyer perching on the shoulders of every doctor, telling them to do all these defensive tests. A lot of those are not needed and are only a response to litigation. And finally, we have a serious problem with mandated benefits. When you have every healthcare policy being the equivalent of a Cadillac, all these mandated benefits add about 20% to the cost of every healthcare insurance program. And so not all these mandated benefits are really necessary. We need to review them in order to make sure that people can get the healthcare that they're entitled to, that they can afford.
Our congressman has offered over 400 amendments to House Bill 3200, and none of them have been accepted. Now, you can't tell me that some of those didn't have some significance. It's time to quit playing partisan politics with health care. One of the bills that we support is House Bill 3400, which keeps the government out of the middle between the patient and their doctor. We believe in portability, where you can carry it from state to state, deductibility, where you can deduct it off your taxes, the cost of health care. We believe in short reform to lessen the cost of insurance, and we also support removal of a lot of the federal requirements, lessening the bureaucratic involvement in health care. Another idea of Republicans is maybe we should approach this as a state issue, like we solve welfare. We look to the states. We look at the states as microcosms of democracy. We see what works in one state or many states before we try this grand Obama-Pelosi-Reid experiment, when 86% of the people are satisfied with their health care. We're jeopardizing their health care to maybe satisfy 14% of the people.